We're actually at a fairly exciting time now, because until now, until the last 10 to 15 years for the most part, there were two mainstays to the treatment of fibroids. Three really. One was suffer, and that really just wasn't appealing to most women. The other was a hysterectomy. The concept is cut out the uterus, you cut out the problem. However, as it might be for many people, the feeling of having to have your entire uterus removed is really just not appealing, and particularly if you're a younger woman, especially if you're desiring future fertility, the concept of having to have your uterus removed is really a poor option in that group. And then there's another group which is called a myomectomy, where they would make an incision on the belly and an incision on the uterus and physically cut the fibroids out, which on the surface seems like a fairly reasonable procedure to do. But the problem with it is it tends to be a fairly bloody procedure. You can end up with a lot of scar tissue as a result of it, and anywhere between 50 to 80% of the time the fibroids grow back anyway. So in the end, many of these patients get a myomectomy done, and in the end they're left with the same problem a few years later. Then they go down the route of needing the hysterectomy. I think one of the first things to be thrown into the ring here was another procedure called uterine artery embolization. That's about 15 years old, so 20 years old. And essentially what that is it's done by the interventional radiologist. They thread a catheter into the artery going to the uterus, and they block off the artery going to the uterus. And then what happens is the fibroids will die off because they're not getting the blood supply. They become ischemic. And because the fibroids are more preferential, they have less well supported blood supply, so they will typically die before any of the other surrounding tissues. And so by decreasing the amount of blood going to the uterus, it can cause the fibroids to shrink down in size and decrease the amount of bleeding that someone has. It's fairly effective. About 85% of women will see some level of relief after the procedure. Again, the problem is the long term and whether or not patients persist in effect, or whether they'll need subsequently secondary procedures. A lot of that depends on what age the patient is when they get the procedure done. Obviously, the patient, if they're closer to menopause, then it's a matter of just getting them through to menopause and they'll be more successful. The more years they have left in their reproductive life cycle, the more chance there is for things to regrow again in the future. There is no such thing. Mm-hmm. Okay. Unfortunately, there's no magic bullet that we can say, take this and everything is better. A lot of what I always tell patients is we have to see what's most important for you in terms of your symptoms, as well as the size and the location of your fibroids. And then we put all of those pieces of information together to help to tailor what's going to be the best treatment for them. As I said, there's a whole bunch of different treatments that we have available to us now. And so a lot of it will be dependent on certain things such as desire for future fertility. Some procedures may decrease the ability to get pregnant because of damage to the surrounding tissues. And so therefore, we would need to try to consider certain procedures if the fibroids are extremely large versus if the fibroids are extremely small. If there's a large number of fibroids, that will also potentially change our treatment path that we might take.